Hit record. All right. So welcome everybody to our quarterly EMIC meeting. My name is Leanne Lowenthal, and I'm the Senior Manager of Immunization Initiatives at the Partnership for Maternal and Child Health of Northern New Jersey. If this is your first EMIC meeting, here's what we do. The Essex Metro Immunization Coalition is a group of concerned community organizations, medical professionals, and advocates dedicated to increasing timely and age-appropriate immunizations. The coalition meets quarterly to discuss immunization initiatives in Northern New Jersey, educational opportunities, and health resources. Each meeting features a special guest on a trending topic in immunizations, and at the end of each meeting, there is time for our attendees to share information on community events and resources. The meetings are recorded and posted on the PMCH YouTube page, which you can find on our PMCH website. So without further ado, I'd like to introduce our co-chair, Dr. Joseph Schwab. Thank you, Dr. Schwab.
Okay, thanks, Leanne, and welcome to everyone for joining us. I hope everyone had a great summer, and as everyone's ready to get back to the work of improving our immunization rates for the children and families in our communities. So a warm welcome to everyone, especially to our guests, who I'll be introducing in a few minutes. So I guess our first and only order of business before we get into our meeting today is to approve the minutes from our last meeting. Those were sent out with the materials for the meeting, and I hope everyone had a chance to look those over. So if anyone has any corrections or additions to be made to the minutes, please let us know now. And if you've had a chance to look at them, I can take a motion to put them into the record, and we'll take a vote when you're ready. Would anyone like to motion to have those entered into our record?
I make a motion to have the minutes as presented adopted into our records.
Okay, thank you, Dr. Sharp. And the second?
I'll second. Iris Cooney from Horizon.
Thank you, Iris. Okay, I think it's easier. We can just put a quick vote into the chat. So yes, no, or abstain, and then Leanne, maybe you can count those up. Okay, so it's my great pleasure to welcome our speakers for today's meeting. As you know, flu season is coming up, and asthma is a very important morbidity that our patients in our community experience. And so our topic today is going to be on asthma. We know that pediatric asthma is a huge concern for so many people and families. And Rutgers University School of Pharmacy, along with the Greater Newark Healthcare Coalition, have brought together students and faculty to spread awareness and education about childhood asthma. This presentation will allow parents and caregivers, as well as professionals who work with children, to learn more about reducing asthma concerns. And so I'd like to welcome our two speakers, Dr. Lucio Volino, who's a clinical professor of pharmacy and director of assessment, as well as Dr. Rupal Mansukhani, who's a clinical professor of pharmacy practice and administration at Rutgers Ernest Mario School of Pharmacy. So welcome to you both, and we're looking forward to your presentation. And then we'll have a time for some questions as well, either through the chat or verbally after the presentation. Welcome.
Thank you. We are so excited to be here to kind of go through some of the basics of asthma management and really go into diving on how we can prevent some exacerbations. So I have two students who will be pharmacists in May, Verena and Justine, and they are going to present today's program. So I'll let them start off the program and share the slides. If you have questions, you can definitely put them in the chat and I can monitor the questions and ask them, or we can definitely do a Q&A at the end of the session. So Verena, I'll let you take the lead.
Thank you so much, Dr. Manzicani. So hi, my name is Verena. I'm a student pharmacist here at Rutgers, and I'm super grateful for the opportunity to speak to you all today and clear the air about asthma. This presentation will be led by me as well as Justine, who will be doing the second half of the presentation. And the goal of it is just to provide some important information to raise awareness about asthma, provide you with some information about recognizing and managing the condition, as well as promoting additional helpful resources for you to view after the presentation for more information. So let's go into what we're going to learn today. These are definitely important points when educating parents and children about asthma, such as what asthma is, what asthma feels like in terms of recognizing it, also to identify triggers that can cause an asthma attack, ways to manage asthma, such as how to use your medications and why you should use them, what you should do if you play sports and you have asthma, seeking help, what is an emergency, what should you do if you have an asthma attack. And then finally, we'll share those resources that are super helpful in sharing with parents to use when learning more about asthma. So first, let's go into recognizing asthma. So most of us can recall that friend growing up that had to keep their inhaler nearby during gym class because they had asthma, or maybe we were that friend. And as Dr. Schwab alluded to before, asthma is super prevalent among children in the United States. So as you can see here, 1 in 11 children in the United States experience asthma. So for the purposes of this presentation, we'll be using the word child and patient interchangeably when referring to these individuals with asthma. In the United States, the prevalence of asthma in children does vary by race and ethnicity, with Puerto Rican individuals experiencing it the most at 21.2%, followed by non-Hispanic Black individuals, non-Hispanic white individuals, Mexican Americans, and then finally Asian, Indian, and Chinese individuals who experience it at a rate of 4 to 5%. In New Jersey, death related to asthma per 100,000 by race and ethnicity affects Black individuals the most at 3.6, followed by Hispanic and white individuals at 1.3 and 0.7 respectively. So the goal of this presentation is to raise that awareness so that we minimize these deaths in the future. Now let's jump into what asthma is exactly. So as you can see in the picture, asthma affects the airways in the lungs, which causes them to narrow, swell, and may cause them to produce extra mucus, which overall makes breathing difficult for the individual experiencing asthma. The early signs and symptoms of asthma can present as early as 5 years of age or older or younger, sorry. However, children can develop asthma at any age, which is super important to know, so that we recognize the signs and symptoms of asthma and bring them to the doctor as soon as we do recognize those signs and symptoms. So, what signs and symptoms should we be looking for? These are some of the indicators. The most common ones include coughing, fast breathing, chest tightness or squeezing. Some of the other symptoms can differ based on how old the child is. So for those younger infants or toddlers, we can see difficulty sucking or eating when they're drinking out of their bottles. We can also see them working harder to breathe, such as their nostrils flaring when they're trying to breathe, as well as a phenomenon called belly breathing or retractions, which we have a video for you later to demonstrate what that would look like. We also see those older individuals, those older children and teens waking up at night due to breathing difficulties. And across the board, we can see a whistling noise while breathing, also known as wheezing, which we do have a video for later on so that you can hear what that sounds like. So this is what wheezing sounds like. We'll play the video for you now. So as you can hear, it is that whistling noise while the patient is breathing, which is referred to as wheezing. There are many other common conditions that a patient can have that can result in this same sound. So not every child that wheezes has asthma. Some other common causes of wheezing include acid reflux disease, obstructive sleep apnea, upper respiratory infections, as well as bronchitis and pneumonia, allergies, So if a child is wheezing, it's important not to assume that the patient has asthma and treat them accordingly, but rather just use that wheezing as a sign that they need to see a doctor and be further evaluated for proper treatment. Next, let's go into the retractions or the belly breathing and what that looks like. So as you can see in the video, the child's belly moves up and down distinctly while breathing. This is an indicator that the child is having difficulty breathing and can be a sign of asthma. Next, let's go into some of the triggers that can cause an asthma attack. This is a really good picture of some of the common asthma triggers that we may experience in everyday life. These include tobacco smoke, dust mites, mold, and furry pets. Asthma can damage the lining of the airway, which makes things that we're commonly exposed to a trigger for an asthma attack. So common irritants, activities, or things can aggravate the asthma and make it harder to breathe. The first of these is smoke. So just making sure that if a family member of a patient does smoke, we want to make sure that we keep that smoke away from the person with asthma, ask them to smoke outside, and keep it separate from that patient with asthma. Flowers, trees, and grass also have the possibility of being an irritant as they produce pollen, and pollen can spike an asthma attack. Others that can cause asthma include pets or animals, dust mites, cold air pollution, perfume room spray, mold as it produces those spores can also trigger an asthma attack. And then finally, a really important one is exercise. So while exercise is super important, it's important to know the strategies to minimize the risk of developing an asthma attack when these patients are running or playing rough or starting to exercise, which we will delve into further later in the presentation. So you may be thinking to yourself, a lot of these triggers look the same as those that can cause allergies, and you're completely right. Because of this, it's important to be able to differentiate between the two. So both allergies and asthma can be triggered by allergens, which are everyday things that we come in contact with that are not harmful themselves, but that the body thinks are harmful. Because the body thinks that they are harmful, the body spikes the immune response to react, and as a result, we get airway swelling. Allergies have very similar symptoms to asthma. However, you do see additional symptoms in allergies, which include red, itchy eyes, sneezing, itchy, runny, or stuffy noses. So when you see these, it's probably an indicator that the child or the patient is experiencing allergies rather than asthma. But regardless, it's really important that if you think your child has allergies or asthma, to get them tested. Allergy testing is super important to make sure that you identify what you're allergic to, and asthma testing is important to make sure that the patient is on the proper treatment. Another important thing to look at is the air quality index outside. You can view this at airnow.gov, or you could simply go on your phone's weather app and scroll down a bit. It shows you how clean the air is outside. So if you look on the spectrum, green is good, meaning that the outside air is not likely to cause problems for patients with asthma. However, as you move down the spectrum to the yellow, orange, red, and purple, then you see that there's more irritants in the air, and it's more risky for those patients that experience asthma to go outside, as they are more likely to develop an asthma attack due to the irritants in the air. So we want to counsel our patients that if they are experiencing asthma, to monitor the air quality index outside, and if the air quality index is in those higher ranges, just to minimize time outside, close as many windows and doors as possible, just to minimize the amount of irritants that they're exposed to. Just as important as the air quality outside, we also want to reduce irritants in the air at home. Ways we can do this is by wearing masks while cleaning, closing the windows when the air quality index is poor outside, using a filtration system with HEPA filters, which removes irritants like dust, pollen, mold, or bacteria from the air, as well as using dehumidifiers to reduce mold in the air as well. All of these ways we can mitigate the irritants in the air at home, just ensuring that there is no outside factors that are causing those asthma attacks. Then, as we alluded to before, it's really important to know how to mitigate the exercise-induced asthma that those with asthma can experience when exercising. So in some children, the exercise can quickly cause these asthma symptoms, especially if they're participating in PE class, sports, after-school activities, camp. But this does not mean that kids with asthma can't play sports or participate in physical exercise, but rather it just means that we need to know how to prepare for them and prevent exercise-induced asthma. So some tips to follow when children with asthma are planning on participating in any kind of exercise, we want to make sure that they take it easy, definitely warm up into the exercise, take breaks throughout, and cool down after they're done. We want to make sure they buddy up so that others around them know that they have asthma. In case that they have an asthma attack, we want to make sure that if they're not able to verbalize themselves, others around them can recognize that they're having the asthma attack and get them the proper treatment and the proper medication. We want to make sure we check the weather and outdoor conditions, such as the air quality index and the levels of pollen that may trigger an asthma attack. And then finally, the children can take their medications if they feel like they can't breathe, of course, and they can also take their quick relief rescue inhalers about 15 to 20 minutes before activity to reduce the risk of them having any kind of asthma attack when they're starting up their exercise. Another really important point to stay healthy with asthma, as PMCH is focused on improving vaccination rates, this is where they play a key role in asthma. It is flu season coming up, and the flu can trigger asthma attacks and worsen asthma, so it's really, really key to stay up to date on your vaccinations. The flu can trigger asthma attacks and worsen asthma symptoms. Getting the flu vaccine thus can prevent a flare-up in these children with asthma. Flu vaccines also, they reduce the risk of getting the flu, they can keep you out of the hospital, and they do prevent death. If individuals with asthma take the flu vaccine, even if they do get the flu after taking the vaccine, it's shown that it will be less severe than if they were to get the flu without the vaccine. It's also important to note that you're not more likely to get the flu if you have asthma. However, individuals with asthma who do get the flu risk developing more serious complications. So while it is important for everyone to receive the flu vaccine, it is especially important for those with asthma to receive the flu vaccine. Let's talk a little bit about the vaccine and when children should be vaccinated. So children greater than or equal to 6 months of age should be vaccinated yearly. However, if it is the child's first time receiving the flu vaccine and they are 9 years old, they are less than 9 years old, they should be receiving 2 doses of the flu vaccine that first time they are getting it, at least 4 weeks apart. This is for the kids to receive the full protection, and then afterwards, after they've received the 2 doses that first year, they can then receive 1 dose each subsequent year they receive the flu vaccine. Some flu symptoms that patients should be counseled to recognize include fever, cough, sore throat, chills, and weakness, as well as the others listed on the screen for you. These are really important to counsel for them to recognize, as the quicker that they're able to obtain medical care after recognizing these symptoms, the quicker that physicians are able to prescribe certain medications if needed that would be able to reduce their symptoms. So antiviral drugs, if used within 48 hours of symptom onset, can make flu illness milder. It can make the patients feel better faster and prevent them from being hospitalized. So it is really important, as soon as they recognize those warning signs and symptoms, to obtain medical care right away. Flu vaccination is super important for everyone. It does lower the risk of life-threatening flu in children by 75%. So regardless of whether or not children have asthma, we should always be pushing for the flu vaccine.
Right, and now moving on to managing asthma. So we have 2 types of medications.
Before we transition, maybe we should just see, does anyone have any questions related to the flu vaccine? Because I know we went through it pretty quickly.
I do have a quick question. That was a great presentation. Thank you. And thanks for emphasizing the flu vaccine. At what age would a pharmacist generally consider it appropriate to vaccinate kids for flu at the pharmacy? Because there's so many kids who can benefit from the vaccine, and it's hard to reach them all in the offices and other venues like the vans and things.
Yeah, so definitely, so this has to do with like some legislative stuff. So during the pandemic, there was an emergency order in place where pharmacists were legally allowed to vaccinate 3 and older, but regulation outside of the pandemic and away from the emergency response protocols that we had in place during the pandemic, pharmacists can vaccinate with a prescription from 7 to 11 for flu vaccine. So they would need either a doctor's prescription or a provider's prescription for the pharmacist to vaccinate the child. And then 12 and older, we can vaccinate without a prescription. So really the recommendation is 12. There is some legislation currently in Trenton that is that is trying to allow pharmacists to continue what we were doing during the pandemic, so 3 and older. So I think if you go to certain pharmacies right now, they may still vaccinate 3 and older because the governor's working with legislation to try to figure it out. But I think most pharmacies have reverted back to the 12 and older for this upcoming flu season.
Yeah, thank you.
Okay, and then there's a question in the chat that says, are 2 half doses still recommended for certain age groups? So the half doses depends on the manufacturer. So what the data is showing is that in the pediatric population, even some of the manufacturers are demonstrating that when you give them a full dose, there's a little bit better protection. So the doses, I would say, depending on the brand that you have or the brand that your patient is getting, you have to look at the package insert. In our pediatric age group, it's still kind of half and half, where it's 0.25 for some brands and 0.5 for other brands. But I think eventually the plan is to go to a full dose for everybody. Lucio, do you have anything to add to that?
Well said. Thank you.
Okay. Any other questions? Okay, great. And then we obviously, due to time, we didn't go through the other vaccines that you have to think about for the lungs, which is COVID. Now we have RSV on the market for the like very little babies, and then the pneumococcal vaccine as well. So those are definitely other vaccines. And if you go to the CDC website to the immunization schedule, and based on your patient's age, go to chronic lung disease, it will show you all the vaccines they recommend for pediatrics based on asthma. Okay, so I will turn it back to Justine. Sorry for the interruption. And if you have questions, please put them in the chat, because I can definitely answer those questions as we're going along.
Awesome, thank you. All right, yeah, so discussing the different types of inhalers. So we have rescue inhalers and we have controllers. So rescue inhalers are our short-acting inhalers, and they're used to quickly open the airways. So these are used as treatment for asthma attacks because they stop the asthma attacks. Examples of these are albuterol, ProAir, Proventil, and Ventolin. Our controllers are more longer acting inhalers, and they keep the airways open and reduce inflammation. So these are used daily to prevent our asthma attacks. Examples of these are Advair, Breo, and Flovent Pulmicort. And these are all inhalers, but there are also other dosage forms such as nebulized liquids and oral and injectable options as well for our patients who may have a hard time with their hand-breath coordination or just figuring out how to breathe it in, especially our children at a young age. So what we just discussed were our FDA-approved prescription medications, and now these are the over-the-counter medications that are not recommended to treat asthma. So Primatene Mist, it's an epinephrine inhalation used to open airways for short-term relief of mild asthma symptoms. Primatene tablets are ephedrine and guaifenesin tablets used to open the airway and thin the mucus. Benadryl are diphenhydramine tablets used to treat allergies and colds. And Vicks VapoRub is ointment used to relieve cough. So again, just to reiterate, these are not what is recommended to treat asthma. Our inhalers are going to be what we mainly use. And then there's further subsections of inhalers. We have the metered dose inhaler, and we have our dry powder inhaler. So our metered dose inhaler, it contains the liquid inside, and that is released as a mist when the canister is pressed down. So this requires hand-breath coordination and may be difficult for our young ones. Dry powder inhalers, it has a dry powder inside that gets crushed and then gets inhaled. So that is typically going to be our prevention, our long use. We also have spacers, and these are helpful for children, our pediatric patients, in bringing all the medication to their lungs. And it helps because it holds the medication inside that little canister, until it can be slowly inhaled through the mouthpiece or the mask. And we'll go into how exactly we use it. But we have two types. We have the mouthpiece type, and they just create a seal using their lips, or we have the mask type, and that creates a seal around their nose and their mouth. We also have nebulizers, and nebulizers are machines that change the liquid medicine into a mist to breathe it in. They may be large, they may require a power source, and they can be kind of noisy, and they take about 15 minutes to use. But these are also very user-friendly for our young patients. And now further on how we use these medications and devices. So I'm going to walk through quickly how we use our meter dose inhaler, and then we'll be able to see a video to walk us through that more in depth. So to use a meter dose inhaler, the child should take off the cap and shake it well, then breathe out completely and create a seal around the mouthpiece with their lips and press down on the canister from on top. That will administer the medication as long as they breathe in slowly and hold for 10 seconds, and then breathe out and recap the inhaler. And just one more thing on this. So oftentimes they may need a second puff to administer their full dose. So then they would just repeat these steps, just starting from step 3. So now we're going to take a quick look at the video, which will repeat these steps.
Using a metered dose inhaler. Take off the inhaler cap and make sure the mouthpiece and spray hole are clean. Shake the inhaler 10 to 15 times. Without the inhaler, take a breath and breathe out all the way. Hold the inhaler upright. Put the inhaler in your mouth, above your tongue, and between your teeth. Seal your lips around the inhaler. Begin to breathe in slowly. Press down on the inhaler one time and keep breathing in. Hold your breath for 5 to 10 seconds. Open your mouth and breathe out slowly.
And then just a funny story that I remember hearing when we were learning this in pharmacy school. Our professor was telling us that the patient came in wondering, like, why isn't my inhaler working? And then the provider said, like, oh, show me how you use it. And then they sprayed it around them, kind of like perfume. So it's really important that we know how to use our inhalers and so that we can teach our young patients as well. So next is how to use our metered dose inhaler with a spacer. So similar process, the patient will take off the cap and shake it well, and then attach the spacer and breathe out. And then if this is the one with the mouthpiece, then they will create a seal around the mouthpiece, or if this is the one that has the mask attachment, then they will place the mask over their nose and mouth, and then press down to administer the dose and breathe in for 10 seconds. Or they can take 6 deep breaths through the mask. So again, this makes it easier. Instead of one big breath that may be difficult for young children to comprehend, the patient can instead take a few deep breaths through the mask. And here's another video to walk us through that.
Using a metered dose inhaler with a spacer. Take off the inhaler cap and make sure the mouthpiece and spray hole are clean. Shake the inhaler 10 to 15 times. Put the inhaler mouthpiece into the end of the spacer. Inhale a deep breath and breathe out all the way. Hold the inhaler and spacer between your pointer finger and thumb. Put the mouthpiece of the spacer in your mouth and above your tongue. Close your lips around the spacer. Tilt your head back a little bit. Press down on the inhaler one time and breathe in slowly and deeply. Breathe in all of the air you can and hold for 5 to 10 seconds. Open your mouth and breathe out slowly.
Okay, and lastly, our dry powder inhaler. So for these, to administer the dose, the patient will slide the button as far as they can, and that should make a click, and that will break the tablet into dry powder pieces, little particles, and then the patient should breathe out, and then holding it like a hamburger horizontally, the patient should breathe in deeply and again hold for 10 seconds, then breathe out and close the inhaler. But in general, dry powder inhalers are not used in children under 12 years of age. Another important note is to make sure that patients are keeping their inhalers clean. So they should be cleaned weekly or even more often if the patient is sick. We do clean them differently though. So for the metered dose inhalers, these can be run under water. So the canister should be removed from the inhaler and the cap should be removed, and it can be run under warm water for 30 seconds for the plastic piece, and then turned upside down, and warm water can run through the mouthpiece for 30 seconds and then air dried. For our dry powder inhaler, however, these should not interact with water because it's a dry powder, any water that gets added to it will turn it into clumps and then it will no longer be able to be administered. So even human conditions can cause this, so it should be stored in a cool, dry place. So again, no soap or water. Instead, we can use a dry cloth or alcohol wipe to wipe them clean and then let it air dry. And to clean a spacer, you can take it apart, soak it in room temperature water and dish soap for 15 minutes, rinse all the pieces again in clean water, and then air dry and reassemble. And it's really important to know when to get help and being able to assess our pediatric patients and knowing when it's important to assess these warning signs that Verena had told us about earlier. So an asthma action plan can be developed with a healthcare provider, and it basically just details what to do and when to do it, depending on what the patient is feeling at that time. So depending on if they're feeling well and they're able to work around like normal, or they are starting to experience some asthma symptoms, or they're starting to suddenly feel worse and it's becoming more of a medical emergency. So this is what our asthma action plan looks like. We have our green, yellow, and red areas that we discussed, and we're going to walk through each of them. So our green section of our asthma action plan means go. This is when our patient is feeling good, they're not coughing or wheezing, they're able to sleep through the night, and they're able to work and play without much interruption in breathing. So the doctor at this point would recommend using controller medications, and then they could write that out for our patients and their families so that everyone's aware of what they should take and how much and how often and when, and to kind of get everyone aligned on what our patients should be taking. Next is yellow, and yellow means caution. So at this point, the doctor would recommend using controller medications and rescue medications, and this would be when the patient is experiencing the first signs of cold. They may have been exposed to a trigger, coughing, wheezing, and tight chest. And again, we would be able to list those out, and everyone can be on the same page about continuing their controller medications, and their rescue medication. And then the red zone is a medical emergency, and the patient should get help from a doctor or healthcare provider right away, and they can try using the rescue medicine again. So this is when the patient is getting worse fast and medicine is no longer helping. Breathing is hard and fast. Their nose opens wide to try to get more air in as much as their body can. The ribs are showing, and we'll see also those symptoms that Verena had mentioned to us earlier. The retractions and the wheezing, and maybe they can't even talk that well as well. So this is again a medical emergency, and if able to get in contact with the healthcare provider, that would be the best option, or to go to an emergency room. And lastly, we're just going to walk through just a couple of quick resources. So we have the Allergy and Asthma Network, which provides a lot of information on allergies, asthma, what is asthma, and how we can treat asthma. The CDC, Center for Disease Control, also has a lot of up-to-date information, and it's constantly getting updated year to year. We also have the Asthma and Allergy Foundation of America. And my personal favorite is the Sesame Workshop website. We were taking a look at it, and they have a lot of videos on how to address these conversations with our pediatric patients and helping them to understand, like, maybe we can't go over our friend's house because they have a dog and that is a trigger for us, or we can take those precautions to make sure that our pediatric patients don't get an asthma attack. So they have a lot of easy to understand videos for our pediatric patients. And lastly, just some general rules to summarize what we talked about today. It's important to have our medications ready and accessible, and our pediatric patients should always have it with them, and they should know how to use their inhalers, as well as any caretakers or any parents in the family or in the house or wherever they are. It's also important to avoid triggers as much as possible so that we don't cause an asthma attack. And that's all. We hope we cleared the air about asthma. Please let us know if you have any questions.
Thank you. That's a great presentation. I really enjoyed it myself. And I think it was really informative for all of us who are working out in the community with families. See some compliments also coming in on the chat. I guess we can take some more questions. Did you want to moderate that, Dr. Mansikani?
Yes, definitely. Any other questions?
I have a question. I was wondering if you guys could speak to why this is such an important topic for Essex County.
Do you guys want to take that, or you want me to handle that?
I mean, we could definitely take it. I would say it's important everywhere, not only in Essex County. We do see that asthma is such a prevalent condition among children, and it's really important that individuals everywhere are made to know like how important it is to recognize these signs and symptoms of asthma so that it's caught early, because we do want to reduce those mortality rates when it comes to asthma, when it comes to something that's so easily treatable. We do want to make sure that everyone is aware of it and everyone's taking the proper precautions.
Well, along those lines, I think this is something that a lot of our families can benefit from. This looks like a presentation that's really geared towards families and patients, right? And so where have you been taking it, and what has the reception been as you roll this out in the community?
So this is my first time giving the presentation actually, but I'm sure Dr. Mansikani can speak a little further as to this presentation.
Yeah, so Lucio and I had worked with a team of people, and the reason that we started doing this presentation is really because in the Newark area is because of some pediatric deaths that were related to asthma. And something that's so preventable, we found that, we were still seeing these pediatric deaths. I think I saw a statistic that I think like in 2017, right before the pandemic, like 11% of people in the Essex County suffered from asthma. And so we found that, the big issue with exacerbations and deaths that were occurring was a lack of information. And so really just we created two presentations. This is the one that we really focus on using for parents or caregivers. And then we have one that is designed for the pediatric patient itself. And we really just want to make sure that people understand the importance of triggers, as well as like, what do you do when you have shortness of breath, and what an asthma action plan, do you even have one? And if you don't, making sure that you talk to your healthcare provider to make sure that they create one with you, so that and if it's the parent that knows if my child is in yellow zone, what to do. And if it's the child, what they need to do if they're feeling these symptoms. And then making sure that they understand like when they need to get help, because I think a few of these patients that passed, it was because they didn't get help in time. And so really our focus and our goal is to work with the Newark area families and asthma children to really educate them on how to prevent exacerbations and how to treat an exacerbation if they're in one, and when to seek help.
And part of that process too was empowering everybody engaged and interacting with anybody who does suffer from asthma or experiences asthma. So we also learned that it's truly, it takes the whole community to come together to help everyone out. And so if we can have steps along the way where people are educated and are aware, then they know what to do from when they have asthma as a child all the way through adulthood and even into the community to help other people in the community. So we thought this would be a great way to provide a support system throughout Essex County to understand where they can go to get help and when to get help. So the goal is to help improve lives across the board.
Yeah, and as a pediatrician working with a lot of families with asthma, I really appreciate this. And I think it's a great benefit for our community to have you working on this here and now in this time and season. I see a question in the chat from Dr. Caruth, some concerns about insurance coverage when people need more than one pump at a time to keep in different places. I can say even sometimes three if they have two homes that they shuttle between as well as school. And Iris gave a little bit of a background, but how can the pharmacists help with that? And if Iris, if you want to add your 2 cents as well, you can do so verbally.
Sure. Does the pharmacy team want to jump in first, or I'm happy to piggyback on the comment? Sure. So first and foremost, in order to get families the prescribed medications that they need and the care, it's really important that they have the coverage in place, right? So make sure that their benefits are up to date, especially if they receive Medicaid coverage. So ensure that they are applying if they are eligible and renewing, to ensure that their coverage doesn't lapse. That's number one. Number two, for families that may have multiple children with multiple asthma-related needs, I would encourage or any type of chronic illness management that families are enduring. I would encourage folks to connect with their care manager, the HMO care manager, because these are folks that are in place to help manage the overarching need of the family, not just like individually and as a family, right? Because usually the head of household is the one that's overseeing all the care. So I would encourage folks to connect with the care manager to ensure that prescriptions for rescue medications are available for the school, for the before and after care program, and for the home, right? Wherever the need is, to ensure that they are getting the prescribed medication and that there's the right person at those entities that knows how to render the medication appropriately as prescribed.
Yeah, and then on the pharmacy side, I think the biggest barrier that we have on the community setting when we're filling prescriptions is making sure that it's covered on their insurance. So there's so many different inhalers, and I think most of the time, if a provider writes for something that is different than what the insurance is covering, then we'll usually call. When it comes to before school time, we definitely have a challenge because you're trying to make sure you have a rescue at school and at home. And what we've learned from the asthma and even some of the parents that we've educated with this program is that schools don't necessarily take the inhalers from the children now. The children actually carry it in their backpacks. And so sometimes you don't need that second inhaler as long as the child is old enough and understands that they need to carry it back and forth from school. But if the child is not capable of doing that, then of course you need a second one. And in those cases, most of the time the pharmacist has to call the insurance company to get like an override. And those are not difficult to get when we need to do those situations. But most of the time we're encouraging the child to carry their rescue with them, because if it's at the nurse's office and they're having an exacerbation or they're short of breath in gym class or in lunch, we want them to be able to treat right away, not try to go to the nurse's office to treat. So is that what you're hearing in the area? Like most of the kids are carrying their inhalers?
Yeah, they are now. Most of them keep their own with them. And if they're old enough and know how to use it, they have authorization to use it themselves.
Yeah, that's what I'm hearing from the parents as well.
Yeah. Thanks. There was a question or a comment. How can these presentations be scheduled? And I know Ebony answered a little bit. I don't know if you wanted to say a few words about the program or if you want to talk about that.
Yeah, definitely. She knows our contact information. So if you send an email to her or Lucio, should we put our email, or John, should we put your email? What's the best way?
I think Jack and Ebony would be our contacts to be able to coordinate, because I know that they're managing all the programs centrally. So I think I would say Ebony and Jack, if there could be any contacts, that probably be the direction to go.
Yeah, hi
Okay.
everybody. I dropped my email in the chat and I can drop Jack's in the chat as well for folks. And Jack and I usually coordinate to get these workshops throughout Newark, East Orange, Irvington, and essentially wherever it's needed. So feel free to send me an email and we can work something out. And I'll usually will coordinate with Dr. Masukani and then Dr. Valino as well to figure out what's the best date, times, and all of the good stuff.
We're just happy that so many people are out today learning and spreading the word so we can protect everyone in our community. So thank you for joining us. And, you know, if as questions come up, please feel free to reach out to us, or if you have more questions, we'll stay on for a few more minutes.
All right, thank you very much. And just one more plug for the flu vaccine. It is very useful for preventing the disease and particularly for the patients with asthma. So flu season is here. We've already started vaccinating in our practice. And so we'll encourage everyone to get their patients vaccinated as well. And then I guess next I'll turn the program over to Leanne for our working group updates. Thank you all for joining us and for that great presentation. We really appreciate it.
Thank you so much for having us. Have a great day.
Thank
you. Take care, everyone. Be well.
Bye-bye.
Wow, what a fantastic presentation. And I would definitely encourage our EMIC members to reach out to Ebony at Greater Newark Health Coalition to schedule something for your families and or your staff. It's as you saw, fantastic information. I'm going to share my screen and just talk about what we've been doing in EMIC. Let me just advance the slides here. So we have, if you're not familiar, we have two EMIC working groups that meet quarterly ahead of our EMIC meetings. We have our education working group and our engagement working group. And so our education working group met on August 19th, and we discussed upcoming EMIC meeting topics. So my big news to share is that we're going to meet in person. Our next quarterly EMIC meeting is going to be in person in Irvington on December 2nd. We're going to talk about hepatitis B. Dr. Schwab will be speaking about maternal and pediatric hepatitis B. We're also hoping to get a speaker on HIV/AIDS and hepatitis B. It's right after World AIDS Day. I am hoping for tabling opportunities. I'm also hoping to have a little bit of food. We're doing this in conjunction with the City of Irvington and the Rutgers HIV outreach program. So more to come on this. It's going to be in the morning on December 2nd. So I hope you guys all can make it. Then our community engagement working group met on August 26th. So just an update on what EMIC looks like. We have 166 EMIC members. We're sending our monthly newsletter to 467 subscribers. And then listen, we're getting into the busy season. You guys know that. We've been at a lot of events in Essex County. We were at the East Orange Farmers Market, the Irvington Back to School Festival and VFC Clinic, and we had a table at the Newark Beth Israel outside their adult clinic, and we're sharing information in the community about immunizations. Upcoming, we are going to bring the folks you just saw to the community. They're going to be at the Unity Family Success Center in Irvington, talking to our families about asthma. We're also going to talk to the families about the flu vaccine. And we're also hoping to have a flu vaccine clinic there as well to get people vaccinated. That's going to be in November, right before Thanksgiving. So again, more information to come on that. If you guys are interested in joining our working groups, again, they meet quarterly for a half hour to an hour. I will send out a link to show you how you can join. We always value your input and are looking for creative ways to share information about immunizations in the community. And then this was pictures from the Irvington Vaccines for Children Clinic. It was also a back to school festival, so people in Irvington could show up. This was a few weeks ago. They could receive their school vaccines. I think 13 kiddos got vaccinated. That it could also receive back to school supplies. And then there was a petting zoo, there was face painting, there was music, on and on and on. It was amazing. And if anyone is here from Irvington, please do it again next year because it was such a fun way to spend the day. So we were really happy to help coordinate and participate in that. And that's it. I'm going to hand it over to Dr. Sharp, who will invite members of our community to share announcements.
Thank you, Leanne. And I would like to also say we really appreciate the presentation from the Rutgers Health students, and it was excellent, excellent. We want to just say hello to all of our partners who are here today. And we want to thank you for your continued support and your continuous efforts and all of the work that you're doing in the community. We want to commend you for such great work that you do in helping our community be progressive and move forward in education and information, which is very much like the session this morning. It was very educational in terms of asthma awareness. If any of our partners today who are new and would like to introduce themselves, please just raise your hand, and I believe it's enough space on my screen where I can call you by name if you would like to introduce yourself. Maybe this is your first or maybe second EMIC meeting. Melissa Hart.
Hi, everyone. So I'm not necessarily new to EMIC, but I am new with the organization that I'm working with. So I am with Rutgers Health, Division of Adolescent and Young Adult Medicine. We do offer free and confidential HIV testing, both in our clinic office as well as our mobile unit. And we also offer family planning services as well for uninsured individuals.
Thank you, Melissa. Anyone else? Well, does any of our partners have any events that's up and coming and you want to just share with us? Kimberly?
Hey everyone, my name is Kimberly. I'm here coming in from CMS. So I just want to let you all know that open enrollment is coming up. So of course, with Medicaid renewals, we want people to be aware of it because vaccinations are covered through Medicaid as well as for elderly patients in Medicare. So please let everyone know about that. We're just really trying to get that out, especially with the rise in COVID this fall. We just really want to make sure everyone's vaccinated. So thank you.
Yes, open enrollment, the most wonderful time of the year. Anyone else? Anyone else? Well, again,
I'm sorry.
please,
I'm
Ebony.
so sorry. Yes. Hi, everybody. Sorry about that. I'll just lower this. It took me forever to find the hand gesture. So how are you guys? Good afternoon. I'm Ebony Steele. I'm new here and I work for Greater Newark Healthcare Coalition as a child and adolescent health program manager. And so as we see, I have a few different partner connections and things, but lately we've been focusing on pediatric asthma within Newark, East Orange, and Irvington. That's just our specific target areas. And so we've been having a few different workshops happening. Today was one that they were able to come in and hopefully provide some needed information to you all. And then we have another one coming up September 26th. But in addition to that, Greater Newark Health Coalition, we're a regional health hub. So we're here to provide resources, information, connection to other partners for your efforts and ours alike as well. So Leanne also mentioned we have our flu shot and asthma soiree health event happening in November. So please just be on the lookout for our promotion related to that. We hope to have a great turnout, but also provide some really great things for families. Nice to meet everybody.
Thank you, Ebony. Anyone else?
Hi, good afternoon. I'm Jasmine Anderson, the Immunization Education Specialist at the partnership. And I just wanted to plug our variety of presentations that we are offering for the community and for professionals on immunizations. I dropped the flyer in the chat, and then the contact information is also included.
Thank you, Jasmine. Anyone else? Well, I've been a partner of IMIC for a number of years, I believe since 2006, maybe. And this IMIC has really been a great help for our community. Bessie Mae Women and Family Health Center, we have a very large program called Pathways to Safety for victims and survivors of domestic violence. And we have partnered with the City of Newark and the Office of Violence Prevention, Trauma and Recovery, and the Brick City Peace Collective. And so we provide domestic violence services and advocacy for men, women, and children who are challenged with that. We see a lot of children who unfortunately have to go through domestic violence, and we work closely with the DCMP. So if you know of anyone that is challenged with that, please, by all means, just send them to us. Other than that, thank you again, our partners. Thank you, Leanne, for being amazing and incredible. And thank you, Dr. Schwab, for leading us as a part of IMIC. I'm turning it back over to Leanne.
Thank you. Dr. Sharp always has the kindest things to say. It's always the best way to conclude. Thank you all for joining. So again, we have recorded this meeting. It will be posted on the partnership YouTube channel. You can reach it via the website, so you are welcome. I'm going to share the link in our upcoming newsletter, and then you're welcome to share it. Also on the partnership website, you can officially join EMIC, getting our meeting reminders and our invites in our monthly newsletter, join our work groups. So thank you to Dr. Schwab and everyone for joining us today, and more to come on our December in-person event. Can't wait to see you guys in person. Take care.
Bye-bye.
Bye.
All right, thanks, Leanne.